Clay County Medical Center is a cutting-edge facility with a comprehensive and community-based outlook on healthcare. Our team is dedicated to improving the health of our communities by providing quality, compassionate care to everyone, every time. With the increasing need for behavioral health services, we recently constructed a dedicated mental health clinic. This will be the new home for our behavioral health team at Clay County Medical Center.
I love my job, and I'm very proud of what I do. So I come to this office and I try to read all my notes before I see my patients. And I make a note what to ask and how they do and things that I need to make sure to ask and make sure. And then I start seeing the patient at 9 o'clock, and that's how my day starts. And during lunchtime and whenever I have time, I try to provide the consult, like somebody calls and asks for a refill, and I try to take care of it, everything as soon as possible for my patients. I took care of a lot of patients, not only with a medical health issue, but mental health issue. But back then, we only had one psychiatric provider. So I decided to take that matter in my hands, and then I decided to go back to school. Nursing takes special heart, and psychiatric nursing takes special and extraordinary heart.
My name is Matthew Myers. I'm a licensed specialist clinical social worker, and I'm the program therapist at Senior Life Solutions at Clay County Medical Center. We have individuals that have an admission here to where they start with the program. Our days consist of groups. It's intensive outpatient is what it's considered with those groups. And so Mondays, Wednesdays, and Thursdays, we provide group therapy for 10 individuals at a time for 3 hours for those 3 times a week. And also the people that do come for this program do get individual therapy 2 times a month. Really started off with a friend asking me to work at a facility in Newark, Nebraska called Epworth Village as a group home for boys. And this was when I was in college, and so it was a summer job that I took as part-time, and that started off my mental health career. That was back in 1993. That led to working at other group homes in Nebraska, a total of 9 years, and landed a job as a case manager here in Kansas. And so I worked that for about 3 years, went to a position of being a supervisor for those case managers. Felt that my career needed to be furthered from that, and so I went back to school after 14 years of being out of school, and went to Washburn to get my master's in social work. So I graduated in 2012 and continued working at a community mental health center as a therapist, and I became a supervisor for those therapists and other types of jobs there. I got my clinical license in 2015, and looked at different career paths and decided to come to the Clay County Medical Center to work as the program therapist at Senior Life Solutions. Yeah, so there's a lot of training around self-care. One advice I give to new therapists going into therapy is get your own therapy. Seek out your own therapist to get that self-care going, and because it can be very trying.
We're outpatient psychiatry, so we have patients come into the clinic just like you would go in for a doctor's visit. They come in and talk to me about how they're doing, how their medications are working or not working, side effects, a little bit of psychotherapy, and then schedule follow-up based on how they're feeling, and then they come back and see me. So anywhere from like a quick 10-15 minute visit to an hour and a half, depending on what's going on. Typically a day would look like seeing patients around 9, having a lunch, and then getting off by 5, going home Monday through Friday, no weekends, no call, anything like that. Averaging, I would say, about 8 to 10 patients a day. I love how the brain works. Initially, I got into this field through geriatrics and memory care, and when I went to school it was across the lifespan, so then kind of found the love for pediatrics and adults and all that. It's very rewarding to be able to help people and just, you know, help them feel better so that they can enjoy life, and yeah.
Welcome to Clay County Medical Center, our family caring for yours.